Hi everyone, you're taking a look at panoramic radiograph of a 8-year-old patient. As you can see from this radiograph, you can notice the permanent dentitions as well as the primary teeth. If you look over to the anterior region, the patient has erupted central and lateral incisors, both in the maxilla as well as mandible. Looks like it may still be erupting a little bit because based on the occlusal plane. You can see that. And then distal to that, we have primary canine, first primary molar and second molar. What's interesting here is if you look to the top, here we see primary canine. However, we're only seeing one of the two primary molars on both sides. I don't know the exact history or the dental history of the patient. Either the patient is congenitally missing the molar, which is unlikely in my opinion, and most likely that the primary molar was prematurely extracted or exfoliated. And then if you look at the above these primary molars, you can actually find that there are two premolars, as you'd expect, two permanent premolars, and this is a canine. So we know that there is going to be a rather significant impaction or significant crowding because of the lack of this space for the eruption. If you look at this side, it's not as clear when you look at it for the first time. Here we have canine. There is one of the two premolars, So then the question is, where is the other premolar, right? And it can be a little bit confusing, but if we follow the outline of the root and the crown very well, you can see that the premolar is tipped distally such that this is the coronal portion of the root or the tooth, and here's that root of that tooth. If we look down below, we have canine, premolars, primary molars, canine, premolars, primary molars. Also note that we have developing crowns of mandibular second molars as well as the maxillary second molars. And distal to that, you can see early signs of calcification of third molars in maxilla as well as mandible. Now, about a year later, took a 4 set of bite wings, and what you see here is that primary molar you saw previously has now been extracted or exfoliated, and we see a erupted one of those two premolars. In this case, this was number 5, first premolar, and that's also true for the opposite side. And here we see erupting canine, and over here is that tip of that canine, and this is a deciduous canine. Down below we have primary molars, and you can see the tip of the permanent premolars and premolars, primary molars, premolars, and there you go, premolar. So the question is, where is that the other premolar in the maxilla? About a year later, they took another bite wing radiograph, and we now see that the exfoliation of the mandibular primary first molars. It's a tongue twister, keep saying premolars and primary molars. Okay, so here we have canine, first pre, second pre, canine, first pre, second pre, and then natural root resorption of this primary molar. Once again, if you look to the top, premolar and canine, and we are still yet to see the other premolar, right? So in order to find out where that is, and also to see its spatial relationship and assess the root conditions of this heavily crowded area, we took cone-beam CT, and that's what I'm going to show you now. Here's a cone-beam CT scan of the patient, and as you know, I like to look at the scan through the axial slides first. And for those of you who have not looked at a lot of cone-beam CT, don't worry about it. I'll take you through the scan step by step. So right here, you should notice that the crowns of the impacted premolars, this being number 4 and this is number 13, is palatally located relative to the alveolar process. Look at the positions of the arch as well as the roots, and look at where the crowns are located, which is palatally located, and even there is a disruption, an expansion and disruption of the palatal cortical plate right here. And over on this side there's an expansion but appears to be intact, at least on this slide. Okay, let me zoom in just a little bit. So here's number 3, mesiobuccal, palatal root, distal buccal root, and that's number 5, this being buccal, and this is the palatal root. As I go up and down, you see that this impacted tooth is abutting mesiobuccal root as well as the palatal root. Let's go ahead and turn this slide, the volume, so that I can cut through the both roots of first premolar as well as the crown of impacted tooth number 4. And this red slide or red line corresponds to this particular slide right over here. So here we see the buccal root and then the palatal root of first premolar, and that's the impacted premolar, and here's the palatal root of number 3. As we look at this area, obviously I spent some time looking through this volume carefully. Some of the things I noticed were that this tooth, this is the first pre, has been displaced or positioned so far buccally within the alveolar process that there is no bone, at least from what I can tell, there's no buccal plate covering the root apex of this root apex of number 5. Thankfully, however, I did not see any discernible or significant root resorption on this palatal root. But another thing that I noticed after having looked at this obviously carefully and at multiple different angles, there is a minimum maybe not on this side, but I didn't think there was any major root resorption on the adjacent teeth. Now let's look at the other side. So let me rotate back. Here again, canine, 11. Here's 12, buccal and palatal. Here's 13, and here's 14, mesiobuccal root, distal buccal root, and then the palatal root. As I scroll up and down, it appears to be in contact with the palatal root of number 12, mesiobuccal, as well as palatal root of number 14. So now the question is there a root resorption or not at these roots? So what I'm going to do is I'm going to bring that red line over and slightly rotate the volume. So once again, I can have this red line go right through buccal and palatal root of first pre, as well as this impacted tooth number 13 and the palatal root of number 14. So that's what you're seeing here. This is number 12, 13, and 14. So as I scroll through left and right, this is the side of contact. And once again, I did not think there was any significant root resorption at this site. However, when we look at the palatal root of number 14, let me see if I can hide the crosshair. Once again, it's very minimal, but I felt that there was a slight resorption or minimal root resorption at the palatal root. Again, clinically, it may not mean it may not have any significance, but as I follow the root outline right here, and there's that follicle, and I go in, and there's a root outline again. So I do think there's a slight resorption right here, but again, it may not make much difference clinically. And even when you look at it in the axial view, you still have a relatively healthy thickness of the dentin or the root at this level of the contact. One more thing that I noticed is that in the axial view, you'll see that this tooth is distally tipped. Do you see that? So the crown is abutting number 14, but its root apex is abutting canine. I know I haven't paid a lot of attention in this coronal slide, but if I were to scroll through, there you go. Impacted, palatally impacted first premolars. Excuse me, second premolars. Well, thank you very much for your attention. I know this was a long video, so I'll try to stop in the next 10-20 seconds. Just wanted to quickly show you this 3D rendering. There you go. You can see where that is located on both sides. But I don't like to use 3D rendering for precise assessment of the root resorption. That should be done on the radiograph, because I can easily remove dental structures by changing the threshold. So this is just to give you a quick kind of glance of where teeth are located in case you're having difficulty orienting yourself in CBCT image. Thank you so much, and I'll see you in the next video. Take care.